Romney will spend the next 10 months crafting his message to appeal to Republicans and independents and will most likely try to distance himself from his time as governor of Massachusetts, where he helped provide almost everyone in the state with health insurance. In the new book by two Globe writers, Scott Hellman and Michael Cranish, they spend a chapter discussing how healthcare reform happened. Here's the story. It began with a conversation with Tom Stenberg, CEO of Staples. They were longtime friends, and Romney served 6 years as a board member of the Fortune 500 company that Bain helped finance. Stenberg said, "Mitt, if you really want to do a service to the people of Massachusetts, you should find a way of getting health care coverage to them. The health care status made no sense. There was a huge number of people going to the emergency room for care at a cost of 3, 4, 5 times what it costs to go to the doctor's office." Romney did not inform Stenberg, but told his staff to spend time looking at the data and talking to experts. In the fall of 2004, Romney wrote an op-ed in the Boston Globe asking for bipartisanship to tackle the issues of health care. Democrats were skeptical. The governor had spent the past year traveling around the state helping Republicans attack Democrats. But Ted Kennedy offered encouragement by saying, "We're basically stalemated in Washington, so the states are going to have to try to come up with their own response." There were 36,000 short-term unemployed persons and 150,000 who were working but did not have insurance since their employer didn't cover it and they were making too much for Medicaid. Romney met with Jonathan Gruber, an economics professor at MIT who traditionally advised Democrats on health insurance. Gruber's computer model predicted how people would react to changes in the system, and it showed that requiring individuals to carry insurance made a lot of sense. Gruber says, "What my numbers showed is that it made enormous sense to have the individual mandate. Without it, the money available for new insurance subsidies would cover half as many people." Massachusetts, too, was one of the few states in the country that had a pool of funds to pay for treatment of the uninsured at hospitals and health centers. It was one of only 5 states that barred insurers from denying coverage or jacking up premiums based on individual health histories. Romney believed in personal responsibility and knew that if younger people paid premiums, it would level the price for a greater population. In 1988, another presidential candidate, Michael Dukakis, was the governor of Massachusetts. With his sights set on the White House, he tried to implement a similar universal health care bill, but it could not get the support from the business community. 16 years later, the major health insurance companies were more interested in reining in costs and were willing to listen to solutions from the public sector. Jack Connors, chairman of Partners Healthcare and civic leader, and William C. Van Fassen, CEO of Blue Cross Blue Shield, led the charge. They were interested in expanding coverage, but also wanted the state to increase the rate in which their hospitals were reimbursed for services to Medicaid recipients, which was a large chunk of their revenue. As the governor's staff continued to work on the details, Connors and Van Fassen sought ways to build political capital for the bill in the State House. To lead the charge, they recruited John Sasso, a former Dukakis staff member who had just finished working on John Kerry's campaign. Sasso had played a key role in Kennedy's defeat in 1994 and was not on great terms with the governor. To smooth over the relationship, Connors asked Joseph O'Donnell, Romney's friend and neighbor, to help set up the meeting. When Romney, O'Donnell, and Sasso finally sat down, it was awkward, but they soon put the past behind them and talked about the policy of the healthcare reform. By the end of 2005, the bill was still stalled in the Massachusetts State House. It needed prodding. Sal DeMasi, the president of the Senate, and Robert Travaglini, the leader of the House, who were normally allies, came out on different sides of the bill and both pushed for different revisions. When the state missed a deadline on January 15, 2006 to get a plan to Washington, Romney drafted a letter to DeMasi and Travaglini. Romney said, "The plane is circling and we have to land it." Never one to build relationships with lifelong politicians in the State House, Romney showed up at their doors on a Sunday morning in January. DeMasi was not there, but Travaglini let him in and explained the urgency of the bill. A few weeks later, DeMasi and Romney met, but the Senate president still would not relent. As the politicians tried to negotiate with each other, the business leaders were ready to move the process forward and accept that the businesses would be penalized for not offering coverage. On March 1st, 2006, Connors convened a meeting at his offices at the John Hancock Tower. Leaders from the big business associations, Partners Healthcare and Blue Cross Blue Shield, agreed to a $295 fair share contribution per employee from a business with 11 or more employees. On March 2nd, DeMasi and Travaglini, who were still bickering, were brought back together by their wives in order to clear the air. Travaglini said, "When communication broke down between the two of us, our wives may have overheard us describing each other in vulgar ways. Maybe around the third bottle of wine, things got a lot clearer." On March 3rd, the business leaders met with DeMasi and Travaglini, and a resolution was agreed upon. A little over 3 years after Stenberg had first broached the subject with the governor, the bill was ready to be signed. A large ceremony was planned for the act providing access to affordable, quality, accountable health care at Faneuil Hall. At the ceremony, Romney called Kennedy on stage and said, "My son said that having Senator Kennedy and me together like this on stage, behind the same piece of landmark legislation, will help slow global warming. That's because hell has frozen over." In reply, Kennedy told the audience, "My son said something too, and that is when Kennedy and Romney support a piece of legislation, usually one of them hasn't read it." Kennedy then said, "This is an achievement for all of the people of our Commonwealth and perhaps the nation."